Sometimes we find these patients with lacking teeth very early on. It could be a trauma happening between 7 to 10 years old. It can also be that at 7 to 10 years old is when you actually realize that this patient don't have the genetic germs that they need to have to grow teeth. So in the beginning, while the jaws are growing a lot, we need to treat these patients with a removable denture. During the removable dentures, we can also use different kind of helps to move the teeth and adjust the bite in a way that we want it to end up when the patient is actually going to have his permanent teeth at the end of maybe 10 years later. When the patients are between 13 to 14 years old, we know that the sagittal growth has ended, and this is the time where we can start to make the long-term temporary solutions for the patients. In most of the cases, we work with resin-bonded bridges, which both looks very nice, and also attach the adjacent teeth in a way so that they don't move and that we actually have the space that we want to, maybe 6 to 7 years later when we want to do the final restoration. So the permanent solutions are not made after the somatic growth has ended. And of course, that's individual between different patients, but we can say somewhere around 20, 22 years old is the time when we usually do the permanent solutions for our patients.